Hello everyone, my name is Ramatu CHWs, a Sierra Leonean working with PIH Partners in Health, a community health worker supervisor. I'm here with my teammates, my fellow supervisors and CHWs. I'm here to talk about the present condition on the ground. In Sierra Leone here right now we have a case that was being detected yesterday and diagnosed positive. As I'm talking to you presently, more cases are found. So the situation on the ground is confusing and scary. As we are the frontliners, the CHWs and the supervisors, everyone in the community rely on us. So we are just confused because some of the information that we have been seeing on social media about the live supporting machines, which we doesn't even have one, so we are worried. But I can still hand over to one of my CHW that will tell you something about the present situation to Ramatu CHWs. Can you please say something?
Hi everyone, my name is Ramatu CHWs, a community health worker being supervised by Ramatu CHWs. Of course, our country now presently, the epidemic is really struggling. We are afraid of the coronavirus and we don't have protective gears. So we need protective gears for us to be safer because we are the frontliners. We need PPE. We need a lot because if we don't have materials, then we are not safe. And our community too is not safe.
Yes, thank you very much, Ramatu CHWs. As I'm handing over to Juliet Kabindi, a female CHW who is one of the most active CHW I have ever worked with. So, Juliet Kabindi, can you please say something to these people?
Yeah, good evening everyone. As you heard from her, my name is Juliet Kabindi, community health worker. As you heard from my colleagues, we are in serious fear now because the community are looking towards us as we are the first liners working for the community. As you have heard from my supervisor, we are the contact between the facility and the community and the facility, and they are looking towards us. So please, we are in big doubt now because the disease is growing. We are pleading so that you can help us as you are from my colleague. Thank you.
Yeah, thank you very much, Juliet Kabindi. I'm handing over to Edith Sheku to tell us about the preventive messages that we have been sharing for these past 2 weeks in our communities. Edith Sheku, can you please tell the people the preventive messages we have been sharing in our communities for these past 2 weeks?
Hello, good afternoon. We have been sharing so many messages to the people, to the community, but the main message we have been sharing is that wash your hand with soap, with clean water, and don't touch. Wash your hand and don't touch. Whenever you touch something, make sure you wash your hand before touching your eyes, your mouth, any part of your body.
Thank you very much, Edith Sheku. So back to the audience. I have my fellow supervisors. Maybe there are some who want to say something. I don't want to point anyone. Is anybody here, Benzin, Momo, can you help us to add your own ideas on preventive messages that have been shared in the community?
Yeah, I'm Benzin Momo, CHW, I say. And we know that this is a black disease in our country and the kind of way it happens in another advancement. We are pleading to everyone and how this to help us with some material, how to prevent ourselves at the community. We know that we don't have nothing to even point out to, even though either it's to be tested or not to be tested. So we are pleading to the people how it is to help our community, Sierra Leone as well, in our community. Thank you.
Okay, just you have heard from my colleagues, my CHWs and some of the supervisors, I have another active female CHW called Kumba Soyama. She's going to speak on the local diet. So listen to her as she's going to say something on our local diet.
Hello, Nakushe and Nakabo Kabo. I dey talk for the present situation wey we dey find ourselves right now. E no easy for we actually, because this problem wey don come all over the world, we sef don get tire so. We don get 2 cases dem, and then case dem dey we na the front line and dem wey the patient dem dey look up to we, wey na the community dey look up to we. Then now we no get no presumptive thing dem wey go use for use. So we dey beg for them go get something dey for una. We dey plead, we dey ask una for no go get anything. So na thank you.
Thank you very much, Mrs. Suyama. I'm here to present a facility-based officer who want to tell us what they have been planning to put in place for the coronavirus, because they are the facility-based officers.
Thank you very much so much. Good day everyone out there. And I'm Sir Samakaba, facility-based officer based in Myanmar. And coronavirus, as we've seen photos, as we've watched videos through the internet, we've seen ways how it destroys lives in China, Italy, now in USA, England. And with all the sophisticated materials people are having there, we see lives are going. And now, few days ago, we've had a confirmed case. And this case made all Syrians to be worried. And yet still we are living in fear. Because if contact tracing is not done at the early stage, it's like it is going to spread as if there's a fire in the bush during the Harmattan season. And now we are just pleading for all health workers, especially those that are in the front line. They need messages to go, and they've already got the messages, because seeing pictures, watching movies concerning coronaviruses. Now they've got the message. Now they are going to the communities. I think they are prone to this disease, because they don't know who they are talking to, whether they are suspect or not. And so what I'm just kindly asking you of is protective gears, and then if you can chip in to help these people, it will be far better enough for them and the community as well. Thank you very much.
Yeah, thank you very much, Mr. Sir. So back to Ramatu CHWs, to crown it all. I can't say everything here today because on Friday I have a lot to say on the conference. So now I just want to crown it all that don't forget us here, because really if the advanced countries are going through what we saw, we don't know what is going to be our own position. Even all borders have been closed, even food, because of we used to work with HIV and TB patients, and these people are more exposed, and these people are always crying for food. So I don't know what will be the next situation for our people. So please, we would like to hear from you guys, because you are always there to help, and as we are always ready to fight the war, because we are the soldiers of this situation. Thank you very much.